Hi, this is Dr. Nick. I'm the Incrementalist here with Incremental Insights for better business, better health.
And I'm Fred Goldstein with Accountable Health here, helping employers, payers, and healthcare systems with their population health improvement programs. So, Nick, one of the areas that gets constant attention is this issue of masks. And there are all kinds of masks. So perhaps you could simplify some of this for us and tell us what's really going on with masks.
Yeah, so let's keep it as simple as possible. I think we're going to see some potential recommendations coming out that say you should upgrade the quality of your mask. How do you do that? Well, at the lowest end is wearing a thin piece of cloth. Then you've got cloth-based masks. And then you have surgical masks, which actually have a plastic layer in, and there's some electrostatic elements. We use those. We've used those in surgery for years and years. And then you get to these what variably called K95, N95, or KN95, which is the Chinese standard, and then the KF94, which is the South Korean standard. They refer to the 95 being we filter out 95% of particles. Those are the highest, well, not the highest end. You can get to respirators and all sorts of levels, but something that you can buy over the counter. And from a quality standpoint, unfortunately, the KN95 is suffering from a lot of fake, so it can be very difficult. So you're probably better with an N95, which is the NIOSH US standard, or the KF94. And the important thing that I keep emphasizing here is if you're going to wear it and you can smell anything, you're not wearing it properly.
Yeah, and I think that's very true. And I think if the KN95s come over your ears, I
Right.
believe, and then the N95s come over the back of the neck and the top of your head with those two bands. And so those, and the key, I guess, as you point out, is to really create a good seal so you don't have any air coming in the outside or through any vents or hole, and it's all coming through the mask. And you, as you said, I believe a number of times, you shouldn't be able to smell certain things if you're wearing one of those correctly.
You should be able to smell anything. Well, I don't know about anything, but yeah, pretty much. I mean, if you can smell smoke, for instance, that's how we test them routinely when we do the fit testing for K90 or N95s in hospitals.
So let me ask you, what do you wear?
I wear a cloth masks. It's got multiple layers in it, and I have an N95 or some N95s that I might use if I was in a specific circumstance. And I have surgical masks occasionally just because they're convenient to carry around. But mostly I wear the cloth-based mask.
Uh-huh.
What about
Interesting.
you?
So I wear a KN95 most of the time, and when I really want to be cautious, I wear an N95. Anytime I'm going through the grocery store, anywhere else, one of those two is on. And usually, and I've started trying to wear a little bit higher level mask as I go around. But I think you're right. Each person, as you've said a number of times, wearing any form of mask is better than none. And obviously, the better a mask, the more
Best
protection you get.
mask you can wear is the one that you're willing to wear and tolerate in as many settings as possible.
And put on correctly, right?
And
as
put
you
on
as you
correct.
point
Yeah.
out, which is a major issue.
Yes,
It
none of
is
this
tough.
chin strap routine. Let's be clear.
So let's move on to something else that's getting a lot of interest these days, which is this rapid antigen testing, Omicron, et cetera. What's going on with that?
Yeah, so this is important. We see a lot of people sort of antigen tests aren't accurate. They're not detecting appropriately. There's some good data, some decent research that says the antigen tests absolutely work, and they work as designed. The PCR test, or nucleic acid amplification test, NAT for short, is the most accurate, but it's technically challenging. And you know that you're having that when they put it into a medium, that's something that the swab gets inserted into, and then it gets transported somewhere. That's all the transportation. The beauty of the antigen test is you can do it in the locale, and we've been using these rapid tests for all sorts of things. I'm pretty sure a lot of people listening will have had a pregnancy test, or have been involved in a pregnancy test, and that's one of the rapid diagnostic tests. They're very accurate. Do they come with some errors, some false negatives? Yes, but it's really, really small in these instances. And the thing about the antigen testing is it tests at a different point. So the PCR test can identify somebody when they're pre-symptomatic, but you've got to know to do that. You've got to be screening, and there's a delay. There are some rapid versions of that. So the Cellular, I think, is the only rapid PCR test that I'm aware of. I'm sure there are others. But you can't do it unless you know to do it, and you've got to screen, and it's more expensive. Whereas the antigen test, as soon as you've got any onset of symptoms, is going to show a positive. And it's very quick and easy. You and I have both done them. We've done them for traveling. And, you know, they should be used for the purpose. Binax is one of the many brands. You know, there are several out there. Obviously, getting your hands on them is the key.
Mm-hmm. And I believe, just for those watching, there was an announcement yesterday by the FDA or the CDC regarding one of those rapid antigen tests that recommended not using it. It's not one of the major names I had seen, but something to look up when you're selecting those, obviously.
Right.
And so the other big news that just kind of poofed into the air was marijuana and COVID. What the heck is going on there?
What are you smoking, Fred? I called it as soon as that paper showed up in my feed, and that was before everybody jumped into this gem of a study that essentially says cannabinoids block the cellular function of SARS-CoV-2 and the emerging variants. But unfortunately, of course, everybody jumps on this, and people are trying to be, you know, I don't know why, but weed does not stop COVID. This is in the laboratory. This is not about smoking as much weed. I'm protecting. And by the way, smoking is a definite no-no in terms of a risk. You know, potentially a dietary supplement, maybe, but actually we really don't know. And it reminds me a lot of the early work on hydroxychloroquine, where we saw it in the laboratory, but it didn't translate into real world. So if you want to smoke weed, maybe it's legal in your state, maybe it's not, but it's not going to help you in terms of preventing COVID.
Well, it's interesting to watch as each of these things come firing out and get hit by social media, as we know, and just explode onto the scene. So we'll have to keep up with that one, and maybe over time it'll go from in vitro to in vivo, and they'll know that this baby actually works. But there were a lot of steps between all that stuff.
Wait, I just want to be clear. You're going to keep up with the weed one, Fred? Is that part of your research driving?
I'll see what the headlines show and just stick with that, right? No, it's really important to look deeper. And as were pointed out in some of the articles about that, you know, the actual agents that come from smoking it are different than what they were picking up in the experiments, and so there's a long way to go before you would see anything like that might show some improvement. So once again, as you look at this stuff, make sure you're paying attention and understand a little bit more, or ask some people, ask your doctor or something about this to get a better sense of it. So once again, Nick, another fantastic week here. This one hopefully did not go up in smoke. And with that, this is Fred Golsey with Accountable Health. Thanks so much for joining us. If you'd like more information, please go to accountablehealthllc.com.
And this is Dr. Nick. I'm the Incrementalist here with Incremental Insights for better business, better health.